Okay, let's unpack this. Imagine a world where treating animal diseases isn't just, managing symptoms, but truly regenerating damaged tissues. Like giving an animal a kind of self-healing superpower.
Right.
Or where we can genetically edit out diseases in livestock, literally writing healthier, more resilient lives for them.
Hmm.
And then there's the constant vital battle against, well, everyday threats and exotic diseases that can shut down entire industries, devastate livelihoods.
Yeah, the stakes are incredibly high.
Today, we're diving deep into a fascinating stack of sources that explore these very frontiers and the daily challenges in veterinary medicine, our mission, to sort of distill the most important nuggets of knowledge and give you a shortcut to being well informed on some truly surprising facts.
Absolutely. What's truly fascinating here is seeing how cutting-edge science, like regenerative therapies and gene editing, isn't just theory. It's actively evolving alongside the persistent foundational challenges of common infectious diseases.
Oh.
We'll connect these dots for you, showing not just what is happening in animal health, but why it matters, the implications for both animal well-being and, crucially, for us. It really does raise an important question, though, doesn't it? How do we balance this incredible innovation with the practical realities, the ethical considerations of animal care, especially when the stakes are so high?
Let's jump right into that innovation then, specifically what's being called the regenerative revolution in veterinary medicine. At its heart, veterinary regenerative medicine, VRM, let's call it, is all about harnessing the animal's own incredible power to heal.
Exactly. Instead of just patching things up.
Yeah, instead of just patching, it's about getting the body to truly rebuild damaged tissues and bring them back to, well, full strength. This is a rapidly evolving area, in both human and animal medicine, and it includes a whole range of cutting-edge approaches, things like orthobiologic therapies, stem cell treatments, other cell-based products.
And the fundamental principle is actually beautifully simple. Replace or regenerate injured tissues to restore normal function. This field really started gaining traction maybe mid-1990s, with early successes using bone marrow-derived stem cells for tendon injuries in horses.
Oh, okay.
In fact, these types of therapies are now formally recognized by the FDA as animal cells, tissues, and cell and tissue-based products, ACTPs for short.
Got it. So when we talk about VRM, there are two primary tools kind of driving this revolution. First, we have stem cells. These are truly unique, aren't they? For their remarkable ability to differentiate into various specialized cell types.
Hmm.
We're talking everything from fat and cartilage to bone, tendon, muscle, even nerve cells. Think of them as the body's versatile internal repair crew,
Really good analogy.
ready to transform into whatever's needed. And then we have platelet-rich plasma, or PRP. This is a concentrated product from the animal's own blood, incredibly rich in platelets.
Right, which are absolutely crucial for the body's natural healing processes because they contain all these amazing growth factors and signaling molecules.
So diving deeper into stem cell therapy, SCT, in veterinary practice, what are we mainly using?
Predominantly, we use adult mesenchymal stem cells, MSCs. We typically get them from two main sources,
Mm-hmm.
either bone marrow, collected through a simple aspiration procedure,
Okay.
or from adipose, fat tissue, which requires a small surgical incision.
And how do they actually work? Is it just replacing cells?
Well, that's part of it. What's truly revolutionary is how these MSCs work to heal. They can directly differentiate into specialized cells for tissue repair, literally replacing damaged tissue.
Mm.
But perhaps even more significantly, they have powerful paracrine effects.
Paracrine effects.
Yeah, essentially, they're not just fixing things directly. They're broadcasting powerful signals to other cells, telling them to grow, to form new blood vessels,
Mm.
and crucially, to calm down inflammation.
Wow.
It's like they're the conductors of the body's healing orchestra.
That paracrine effect, that's fascinating. It's not just replacement parts then, but orchestrators.
Exactly.
Now let's talk about platelet-rich plasma, PRP. This also comes directly from the patient's own blood, right?
That's right. It's prepared by taking a blood sample and then processing it in a centrifuge,
Okay.
which, uses spinning to separate and concentrate the platelets into a smaller volume of plasma.
And this stuff is packed with growth factors.
A powerhouse of natural growth factors, yeah. These are like the body's own construction managers,
Yeah.
coordinating everything from building new tissue to shutting down inflammation. These growth factors promote cellular proliferation and differentiation, help form new blood vessels, modulate the immune response, reduce those inflammatory signals.
They do a lot.
They do a lot. And they even recruit other reparative cells, including stem cells. Plus, the PRP can form a fibrin clot, which acts as a natural
A
scaffold.
scaffold.
Yeah, providing a framework for those stem cells to do their work. It's like a whole ecosystem of healing in a single injection.
Incredible. It truly is. Now, let's look at the clinical realities. What can these therapies actually do? And maybe what can't they do?
Good question. For stem cell therapy in, say, dogs and cats, its most common and successful application is for osteoarthritis.
Okay, arthritis. Makes sense.
It aims to rebuild cartilage and significantly reduce inflammation, leading to improved joint function and hopefully a better quality of life. Beyond that, there's significant ongoing research into potential uses for repairing bone, ligament, spinal cord injuries, certain kidney and liver diseases, even some neurological disorders.
But what about something like cancer?
Ah, that's absolutely crucial. It's vital to understand that stem cell treatment for cancer is generally not appropriate.
Right.
There's a potential risk of worsening or even spreading the cancer. So that's a definite no-go area, generally speaking.
That's a very important distinction. Good to know. And what about PRP? You said it was versatile?
Incredibly versatile. It's frequently used for a range of orthopedic conditions. Osteoarthritis again, hip and elbow dysplasia, OCD. It also accelerates healing in soft tissue injuries like partial tendon and ligament tears.
Partial tears. What about a full tear, like an ACL?
Good point. It's important to note it cannot regenerate a completely torn ACL on its own,
Okay.
but it can significantly aid in post-surgical recovery for those cases.
Got it.
Beyond orthopedics, PRP is used for wound healing, post-surgical recovery, various dental procedures, and even in dermatology and ophthalmology.
Wow, okay. So what do these advanced therapies actually mean for the animal? Let's focus on the benefits compared to maybe more traditional approaches.
Okay, benefits. For both SCT and PRP, the shared benefits are pretty powerful. They leverage natural healing using the animal's own materials.
Which minimizes rejection, right?
Exactly. Minimizes rejection, leads to pain reduction, improved mobility, and a big one, this can significantly reduce reliance on traditional medications.
Which often have side effects.
They often do, yeah. And the procedures themselves are usually minimally invasive.
And specifically for stem cells.
For stem cell therapy, it often addresses the root cause, not just symptoms, leading to potentially long-lasting improvements. Relief can sometimes extend for 1 to 4 years, and a remarkable benefit is cell banking.
Cell banking.
Yeah, you can bank cells for future retreatment without having to do another harvest procedure.
That's clever. And PRP.
With PRP, you often see accelerated healing, reduced recovery time, sometimes even almost immediate results in certain cases. Plus, it's incredibly convenient, often done in a single visit, maybe under an hour.
Okay, those benefits sound almost too good to be true. There have to be caveats, right? What are the limitations, the challenges veterinarians and owners face?
That's an excellent question because, yes, despite these compelling benefits, there are important limitations, challenges, and risks. For both SCT and PRP, some shared concerns include their often high costs, especially stem cell culture. That can be quite pricey.
Yeah, I bet.
And there's variability in outcomes between patients. It doesn't work perfectly for every single animal.
Right.
They also require specialized equipment and expertise, so not every clinic can offer them. And there's still a lack of fully standardized protocols.
Meaning treatments might vary a bit place to place?
Potentially, yeah.
Mhm.
Consistency can be a challenge. And, high-level scientific evidence for all potential applications is still somewhat limited, though growing.
Okay. What about risks specific to stem cells? You mentioned harvesting.
Right. With stem cell therapy specifically, animal welfare and consent issues are things to consider. Harvesting cells can be invasive, causing potential pain or discomfort, and there's a small, very small, but important risk of unforeseen side effects like, theoretically, tumor formation or immune reactions, though these are rare in practice.
And regulations. You mentioned the FDA.
The regulatory hurdles are substantial.
Mm.
In the U.S., the FDA regulates these ACTPs as new animal drugs,
Which means
which means they're subjected to a very stringent, very costly pre-market review process. Critics argue this approach, while ensuring safety, can unfortunately stifle innovation sometimes. It makes it hard to get new therapies approved.
I see. And for PRP, are there specific risks there too?
For PRP, specific risks include, well, limited efficacy for certain conditions. Again, it's not a magic bullet for a complete ligament rupture, for example.
Right.
Availability can be an issue. Not all practices offer it. While generally safe, there's always a potential, though low, for adverse effects like inflammation or infection at the injection site. And of course, both therapies usually require sedation or anesthesia, which always carries some level of risk. patient suitability has to be carefully assessed.
It's clear that while these regenerative therapies are revolutionary, they definitely bring a unique set of considerations.
Okay, let's zoom out a bit. Let's look at the broader context of veterinary medicine and explore another truly cutting-edge area: gene editing in animals.
Ah, yes, gene editing. When we talk about gene editing, we're often talking about technologies like CRISPR-Cas9, right? Which enable these incredibly precise modifications to an organism's DNA.
Exactly. It allows for rapid introduction of desirable traits that were, frankly, unthinkable or would take generations with traditional breeding methods.
So what are the applications? Where is this being used?
The applications and benefits are truly vast and, honestly, potentially world-changing. In farm animals, the goals are often similar to traditional breeding: better health, better productivity, but achieved with much greater precision and speed.
Like what specifically?
Well, increasing yields, for instance, switching off a specific gene, myostatin, for increased muscle mass in cattle, pigs, sheep, or targeting another gene, FGF5, for better wool production in sheep.
Wow.
A huge area is disease resistance. This is really exciting. Editing pig genomes to resist devastating diseases like African swine fever, seeing maybe a 70% reduction in susceptibility.
70%? That's huge.
It's massive. Or combating PRRS, another major swine disease, developing resistance to avian influenza in chickens.
That could save industries.
Potentially, yes. Gene editing can also improve product quality. Think hypoallergenic eggs or milk, or even producing humanized milk in cattle for specific medical uses.
Humanized milk.
Okay. And it can even enhance animal welfare directly. For example, introducing a natural polled or hornless gene in dairy cattle to avoid the painful process of dehorning.
That makes a lot of sense. What about pets or lab animals?
For pets, gene editing is being explored to target specific inherited genetic disorders, like progressive retinal atrophy in dogs or hypertrophic cardiomyopathy, a heart condition, in cats.
Fixing genetic diseases at the source.
That's the hope. In laboratory animals, it significantly enhances the creation of disease models, potentially reducing the total number of animals needed for research, which is an important ethical consideration.
Definitely.
And then there's the really futuristic stuff, like xenotransplantation.
Transplants between species.
Exactly. Modifying pig genes to reduce immune rejection and inactivate viruses that could pass to humans, paving the way for potential pig-to-human organ transplants someday.
Mind-blowing stuff. And even ecological uses.
Yeah, it's even being explored for ecological engineering, like potentially controlling malaria-carrying mosquitoes by altering their genes.
So, okay. We can literally rewrite an animal's genetic code for all these incredible benefits. What are the catches? What are the profound ethical and societal questions we need to grapple with here?
That really is the heart of the debate, isn't it? On the animal welfare and health front, there are genuine concerns about unintended consequences.
Like side effects.
Exactly. While we're aiming for desirable traits, there can be off-target effects, accidental changes elsewhere in the genome, or other genetic disruptions leading to unforeseen health issues. Increased disease susceptibility in other ways, maybe reduced fertility, or abnormal physical traits. For example, that increased muscle mass might paradoxically lead to musculoskeletal problems.
Ah, okay. Trading one problem for another, potentially.
Potentially. And the processes involved in creating these new genetic lines can also be invasive. Procedures like superovulation or surgical embryo transfer. It often means a large number of animals are produced for very few desired results. And there can be unpredictable effects on an animal's behavior and overall well-being that we just don't foresee.
And what about the ripple effects? Beyond the individual animal, environmentally, or for how society views these animals?
Well, environmentally, there are ecological risks if genetically modified animals were ever released, intentionally or accidentally. Think about gene flow to wild populations, competition, unknown long-term effects on ecosystems. We have to be careful.
Absolutely.
Societally, public perception is also hugely varied. While therapeutic uses for diseases are generally more accepted.
Like fixing genetic disorders.
Right. But non-disease uses, like cosmetic changes or just enhancing production efficiency, can face significant public aversion. People get uneasy.
Understandably.
And then there are broader ethical questions about, the naturalness of animals. How does genetic engineering impact the human-animal relationship? Does it create an imbalanced power dynamic?
Deep questions.
And let's not forget intellectual property concerns. Patenting gene-edited animals can unfortunately limit data sharing, potentially lead to duplication of research efforts. Even disposal restrictions for genetically engineered animal carcasses can be an issue.
Wow, that sounds like a minefield. So, if the regulatory landscape is so complex, does that mean these revolutionary technologies are just sitting on the shelf? Or are companies finding ways forward?
It's a significant hurdle, no doubt. These complex ethical considerations are reflected in the regulatory frameworks, which, as you might guess, vary wildly across the globe.
How so?
In the United States, the FDA regulates intentional genomic alterations, or IGAs, in animals as if they were new animal drugs.
Like the stem cells we talked about.
Exactly. Which subjects them to that very stringent, very costly pre-market review process. Many in the industry perceive this as stifling innovation, effectively blocking approval pathways for many potential products.
So, not much has actually been approved then.
Very little for food animals. To date, only a handful, like the AquAdvantage salmon, which grows faster, and Gal-safe pigs, which lack a specific sugar that causes allergies.
Okay. And elsewhere, like the EU.
In the European Union, these new genomic techniques, or NGTs, are generally defined as GMOs, genetically modified organisms.
Ah, the GMO label.
Right, which means they're subject to strict safety assessments, authorization, labeling, traceability requirements. It creates its own set of challenges, especially as it can be very difficult to detect unauthorized gene-edited products without knowing exactly what DNA sequence to look for.
So it makes trade complicated too.
Very. These diverging global requirements can create significant technical barriers to international trade in animals and animal products. It's a complex global picture.
Okay. So we've explored how science is literally rewriting the code of life for animals, pushing boundaries. But while these cutting-edge innovations promise a healthier future, vets on the ground are still battling some ancient, persistent enemies.
Absolutely.
Challenges that have plagued livestock for generations and impact livelihoods every single day. Let's shift from the lab bench to the farm now. Let's tackle some of the bovine big three. First up, calf septicemia.
Right, calf septicemia, a severe, often fatal, systemic bacterial infection in newborn calves.
Yeah.
It's basically characterized by bacteria invading the bloodstream, leading to widespread inflammation and organ dysfunction.
And the main causes.
The most common underlying cause is something called failure of passive transfer, or FPT.
Failure of passive transfer, what's that?
It happens because a newborn calf's immune system is very immature at birth. It relies entirely on maternal antibodies, mainly immunoglobulin G or IgG, absorbed from the mother's first milk, the colostrum.
And they have to get it quickly, right?
Yeah, critically quickly, within the first few hours of life. If they don't get enough or get it too late, they have FPT and are highly vulnerable. Infections commonly enter through the umbilical cord, or just from ingesting bacteria in a contaminated environment, or from contaminated colostrum itself.
And here's an unexpected twist I read about colostrum. It provides so much more than just antibodies.
Oh, absolutely. It's truly packed with non-immunoglobulin components. We're talking the essential growth factors like IGF-1, growth hormone, insulin, powerful antimicrobial peptides like lactoferrin, vital immune cells,
Wow.
even oligosaccharides that act as prebiotics, feeding good gut bacteria, vitamins, a trypsin inhibitor to help antibodies get absorbed. It's a complete starter kit for life.
Amazing stuff. So back to septicemia. What are the signs?
It truly is a miracle substance. For calf septicemia, clinical signs can vary. In acute cases, typically in calves just 2 to 5 days old, you see a rapid downward spiral. Profound weakness, inability to suckle, abnormal body temp, rapid heart rate, maybe tiny hemorrhages called petechia, sometimes meningitis signs.
That sounds terrible.
It is. Less acute or chronic forms, maybe in calves 7 to 28 days old, present with milder signs. Often localized infections pop up, like infected joints causing arthritis or pneumonia or pus in the eye, hypopion. Differentiating it from just primary diarrhea can sometimes be tricky too.
So how do vets diagnose it, especially on the farm?
Diagnosis often starts with that clinical assessment. The signs are pretty suggestive. Definitive diagnosis is a blood culture, but that's slow. Crucially, assessing FPT quickly is key.
How do they do that fast?
Well, the gold standard lab test, RID, is slow and costly, but practical on-farm tools are available. A simple blood test for serum total protein, STP, or using a Brix refractometer on the blood serum.
Like they use for colostrum quality.
Exactly. There are established cutoffs, like below 5.5 grams per deciliter for STP, or below about 7.8 to 10% Brix that strongly suggests FPT. A CBC might show an inflammatory levogram, and blood gas analysis often shows metabolic acidosis.
And treatment sounds like it needs to be aggressive.
Prompt and aggressive is essential, yes. Mortality is very high otherwise. This involves long courses, 10-14 days or more, of broad-spectrum IV antimicrobials, plus extensive supportive care.
Like what?
Fluid therapy for dehydration and shock, plasma transfusions if FPT is confirmed, correcting that acidosis, NSAIDs for inflammation and pain, nutritional support, often tube feeding if they won't suckle, respiratory support if needed, and just really good nursing care like clean, dry bedding.
So it really comes down to prevention then. Constant vigilance and good management.
Absolutely. It's amazing how much difference those first few hours make. Ensuring proper colostrum intake is literally life or death.
So prevention focuses on
Optimizing colostrum management. The 4 Qs. Quantity, about 4 liters or 10% of body weight for a Holstein calf. Quality, testing it, aiming for IgG over 50 GL or Brix over 22%. Quickness, within 1-2 hours of birth, definitely within 6. And cleanliness.
cleanliness of the colostrum itself.
Yes, bacterial contamination is a big issue. Pasteurization helps if feasible. Plus general farm hygiene, proper navel care, dipping the navel in 7% iodine tincture daily for a few days, reducing stress, and sometimes vaccinating the dams pre-calving can help boost colostrum quality.
That attention to detail is clearly paramount. Okay, moving on to our second bovine big three, lumpy jaw, or actinomycosis.
Right, lumpy jaw.
This is a chronic infectious disease mainly affecting the jaw bones, forming that characteristic slow-growing, firm, immovable mass. And what's truly remarkable, you mentioned this, is that the bacterium causing it, Actinomyces bovis, is actually a normal mouth bug.
Yeah, it's a normal oral inhabitant. It's an opportunist.
So how does it cause disease?
Transmission occurs when this bacterium invades deeper tissues through breaks in the mouth lining, oral abrasions. These are commonly caused by coarse or fibrous. Feeds things like dry, stocky hay, straw, or sharp plant awns from certain weeds or crops. Even erupting teeth in young animals can create an entry point.
And the signs.
The early sign is usually just a hard, painless swelling on the jawbone, often the mandible. As it progresses and the bone infection worsens, you might see draining tracts opening to the outside, oozing pus.
And this pus has something characteristic.
Yes, often it contains these small, gritty, yellow sulfur granules. They're actually colonies of the bacteria. This leads to difficulty eating, pain, weight loss, facial distortion, sometimes even difficulty breathing if the mass gets really large.
How is it diagnosed and treated?
For lumpy jaw, a presumptive diagnosis is often made based on that characteristic hard, bony swelling and finding those sulfur granules in the pus. Radiographs, X-rays can show the typical honeycomb bone lesions. Lab tests, like a Gram stain of the pus, reveal the characteristic bacteria. Culture is tricky because it's anaerobic and often negative. Biopsy can confirm it.
And treatment, can you cure it?
Treatment aims primarily to halt the progression. The existing bony mass usually doesn't shrink significantly, unfortunately. It typically involves long-term antibiotics. Penicillin is common, sometimes combined with iodides given orally or IV. Surgical drainage and debridement might be attempted if there are soft tissue abscesses associated.
But it's tough.
It is tough. Antibiotics struggle to penetrate that dense bone and the thick abscess walls. Relapses are pretty common. Given the long treatment and guarded prognosis for complete cure, producers often have to consider salvage slaughter for economic reasons.
Right, so prevention is key again.
Prevention focuses on careful feed management, trying to avoid those really coarse, abrasive feeds or sharp plant materials. Good environmental control helps too. And just early detection. There's no vaccine available for lumpy jaw.
And the economic impact.
It can be significant. Productivity losses from reduced feed intake, poor weight gain, maybe decreased milk production in dairy cows, plus treatment costs, and definitely reduced market value for affected animals.
It's incredible how a common oral bacterium can cause such a persistent, deforming problem. Okay, our final bovine big three for today. Bovine retropharyngeal abscesses.
Ah, yes, abscesses behind the throat.
A collection of pus located deep behind the pharynx in a very critical spot. You mentioned this location is incredibly sensitive.
Extremely. It's right near major blood vessels in the carotid sheath, the pharynx itself, the esophagus, important nerves, the airway. And there's a fascial plane there, sometimes called the danger space.
Danger space. Why?
Because infection in that retropharyngeal space can track downwards along these tissue planes, potentially leading straight into the mediastinum, the space around the heart and lungs in the chest, which is often fatal.
Wow. And young animals are more prone.
Yes, their retropharyngeal lymph nodes are more prominent and reactive, and these often seem to be the starting point for infection.
What causes these abscesses?
Often bacterial infections following some kind of trauma to the back of the throat. A common cause is improper administration of oral medications, using things like ball and guns or drenched syringes that scratch or penetrate the tissue.
Ouch.
Yeah. Or migrating foreign bodies, like sharp pieces of wire or plant material ingested in feed. Sometimes it's spread from upper respiratory tract infections. The microbiology is often polymicrobial, meaning multiple bacteria are involved. Common players include Fusobacterium necrophorum and Truparella pyogenes, both nasty pus formers.
What are the clinical signs? How would you know an animal has one?
Clinically, signs primarily affect swallowing and breathing. You'll see dysphagia, difficulty swallowing, maybe excessive drooling, anorexia because it hurts to eat, sometimes nasal discharge containing feed material.
And breathe.
That's often the most alarming sign. Progressive inspiratory dyspnea, difficulty breathing in. You might hear stridor, which is noisy breathing. They often stand with their head and neck extended to try and open the airway. Sometimes you can feel subcutaneous emphysema, like crackling under the skin and the throat area, if the abscess has ruptured internally. The severity really correlates with the size of the abscess and how much it's compressing the pharynx and larynx.
Diagnosis sounds challenging.
It relies heavily on those clinical signs, but advanced imaging is often key. Radiographs can show soft tissue swelling pushing the airway down. Ultrasound is highly useful. It can differentiate an abscess, fluid-filled, from just cellulitis, general inflammation, and is crucial for guiding drainage attempts. CT gives a definitive look at the extent, and MRI is superior for tissue detail, but less commonly available for cattle.
Lab tests on aspirated pus, culture, and a CBC can help too.
And treatment, you mentioned it's critical. Critical and prompt intervention is needed due to those potentially life-threatening complications. It's usually a combination approach. Long courses, weeks of broad-spectrum IV antibiotics are essential, and surgical drainage is usually required.
How did they drain it?
Typically a ventral approach, making an incision from underneath the jaw to access the space, drain the pus, flush the cavity thoroughly, debride dead tissue, and remove any foreign body if found. Supportive care is also paramount: 5E fluids, nutritional support, and careful airway management. Sometimes a temporary tracheostomy is needed if breathing is severely compromised.
What are the main complications in the outlook?
Complications are severe. Airway obstruction can be rapidly fatal. Aspiration pneumonia from inhaling pus or feed material is also often fatal. Spread of infection down into the mediastinum, mediastinitis, is usually fatal. Vascular complications, systemic sepsis, neurological deficits are also possible. The prognosis is generally guarded to poor, especially if treatment is delayed. Recurrence is unfortunately common too.
And the economic impact must be considerable.
Very significant. These abscesses are often associated with bovine respiratory disease, BRD complex, particularly in feedlot cattle, which is a huge economic drain itself. Plus, there are direct production losses from weight loss or decreased milk, the high costs of intensive treatment, and morbidity mortality.
Phew, so many challenges on the ground for producers and vets. Okay, let's shift focus one last time for our Global Watch segment. We turn our attention to vesicular stomatitis, or VS.
Right, VS.
This is a highly contagious viral disease, mainly affecting horses, cattle, and swine. And what's particularly interesting, maybe a bit concerning, is that humans handling affected animals can also get a flu-like illness from it.
That's correct. It is zoonotic. It's caused by vesicular stomatitis viruses, which are billet-shaped RNA viruses. The New Jersey and Indiana serotypes are the main ones causing outbreaks in the Americas.
Which animals are most susceptible?
Primarily equids, horses, donkeys, mules, cattle, and swine. Sheep, goats, llamas, and alpacas can also be infected, usually less severely. Wild animals like deer and rodents can act as reservoirs. And here's a key point for you to remember. VS is the only vesicular disease, meaning blister-causing disease, that naturally affects horses.
Ah, only one in horses. That's important. How does it spread?
Epidemiologically, it's endemic in warmer tropical parts of the Americas and tends to spread north into temperate zones like the U.S. or south into parts of South America during the warmer months, often in cycles. The exact spread mechanism isn't perfectly understood, but biting insects, particularly black flies, sandflies, and culicoids midges, are considered the most common transmission method. They act as vectors.
So insect bites are key.
They seem to be the main driver of outbreaks. But it can also spread through direct contact with infected animals. The fluid from the blisters is infectious, or via contaminated fomites, things like equipment, feed bunks, water troughs.
What does it look like clinically?
Clinical signs typically appear after an incubation period of maybe 2 to 8 days. The hallmark is painful lesions that start as vesicles blisters, which then rupture fairly quickly to form ulcers.
Where do these blisters appear?
Common sites are the oral cavity, lips, gums, tongue. On the feet, especially around the coronary band just above the hoof, and on the udder or teats, or sometimes the prepuce or vulva.
Sounds painful.
It is. This leads to excessive salivation or drooling, reluctance to eat or drink, subsequent weight loss, lameness if the feet are affected, decreased milk production in dairy cows, and the open sores are prone to secondary bacterial infections.
How serious is it? Is it fatal?
Generally, it's self-limiting. Animals usually recover within about 1 to 5 weeks, although the lesions can take time to heal completely. Deaths are rare, usually only in very young or debilitated animals, or due to complications like severe secondary infections or dehydration.
But you mentioned something crucial earlier.
Yes. The crucial distinction here, and this is paramount, VS is clinically indistinguishable from foot and mouth disease, FMD, and also from other less common vesicular diseases like swine vesicular disease or vesicular exanthema of swine.
They look the same.
To the naked eye, the lesions look identical. This is why laboratory testing is absolutely required for a definitive diagnosis whenever vesicular lesions are seen in livestock. You cannot tell them apart just by looking.
And that distinction is critical because of FMD.
Absolutely critical. FMD is arguably the most feared foreign animal disease for the livestock industry globally.
So how do they diagnose VS and rule out FMD?
Diagnosis relies on detecting the virus or the animal's immune response to it. Virus identification methods include virus isolation and cell culture, real-time RT-PCR for rapid detection of the viral RNA, that's often the go-to now, or antigen detection, ELISAs. Serology, looking for antibodies in the blood, can also be done using tests like ELISA, complement fixation, or virus neutralization, though antibodies can persist for a long time after infection.
What kind of samples do they need?
The best samples for virus detection are vesical fluid from unruptured blisters or epithelial tissue from the edge of freshly ruptured lesions. These need to be handled properly, kept cold, often in specific transport media.
And the differential diagnosis ruling out FMD.
This is the absolute priority. FMD affects cloven-hoofed animals, cattle, pigs, sheep, goats, but crucially, not horses. That's the single biggest clinical clue.
So if horses are affected, it's likely VS, not FMD.
Exactly. FMD also tends to cause more severe hoof lesions and can cause sudden death in young animals due to heart muscle damage, the so-called tiger heart. But you still need the lab confirmation. A confirmed case of FMD in a previously free country like the U.S. would have absolutely devastating economic consequences due to immediate trade bans and costly eradication efforts.
Unimaginable. Are there other diseases it could be confused with?
Briefly, yes. Other differentials might include things like blue tongue, which can cause oral and coronary band lesions, particularly severe in sheep. Bovine viral diarrhea, BVD, can cause oral ulcers. Malignant catarrhal fever can too, but none typically cause the distinct vesicles like VS or FMD.
Okay. So if an animal gets VS, what's the treatment? Is there a cure? A vaccine?
Currently, there is no specific antiviral treatment or cure for VS. And importantly, no vaccines are licensed or widely available for routine use in the U.S. or many other countries.
So what do you do?
The focus is entirely on supportive care, managing pain and inflammation with NSAIDs like flunixin or phenylbutazone, providing nutritional support, maybe offering soft, palatable feeds if the mouth is sore, ensuring access to fresh water, and managing secondary bacterial infections, for instance, treating mastitis if the teats are affected, but antibiotics only if there's clear evidence of bacterial complication. The virus itself just has to run its course.
So prevention and control are everything.
Absolutely. Prevention and control primarily rely on biosecurity and movement restrictions during outbreaks.
How do you prevent it? Especially if insects are involved.
Insect control is considered the primary prevention method. This involves trying to eliminate insect breeding areas near livestock, using approved insecticides on animals or premises, and maybe bringing animals indoors during peak insect activity times, like dusk and dawn.
And biosecurity.
Strict hygiene and sanitation are key. Cleaning and disinfecting equipment, using individual feeders and waterers if possible, especially during an outbreak, isolating sick animals immediately from healthy ones.
And reporting is mandatory.
Yes. Suspected cases of any vesicular disease, including VS, must be reported immediately to state or federal animal health authorities. Affected farms are placed under quarantine, usually for at least 14 days after the last lesions have healed on the last affected animal. This stops movement and prevents further spread.
And the public health aspect.
Humans handling affected animals, like vets or producers, need to use personal protective equipment. Gloves are essential, and practice good hygiene to avoid contracting that flu-like illness.
What's the overall economic impact?
It's a significant threat. Even though mortality is low, it causes substantial economic losses due to lost production, reduced milk yield, weight loss, impacts on performance animals like horses, plus the cost of diagnosis, supportive care, and crucially, the impact of quarantines and trade restrictions. Many countries, and even some U.S. states, impose movement restrictions or testing requirements on animals from affected areas, which disrupts commerce significantly.
Phew. We've truly covered a tremendous amount in this deep dive. I mean, from the incredible regenerative capabilities being unlocked with stem cells and PRP,
Yeah, really amazing potential there.
to the profound ethical questions raised by the frontiers of gene
A
editing,
lot to think about.
and the relentless daily fight against widespread and economically devastating diseases like calf septicemia, lumpy jaw, and vesicular stomatitis. You now have, hopefully, a serious shortcut to being well-informed on some truly cutting-edge and critical aspects of veterinary medicine.
Indeed. And if we try to connect this all back to the bigger picture, the advancement of science in veterinary medicine really offers incredible hope. Hope for animal welfare, hope for agricultural productivity.
Yeah.
Yet, as we've explored today, each innovation and every single disease battle comes with its own set of challenges, right?
Right. Cost regulation.
Cost, regulation, the need for constant vigilance against nature itself, it's never simple. And this raises, I think, an important question for you, the listener, to consider. As these technologies, like VRM and gene editing, become more accessible, and as our understanding of animal health deepens,
Mhm.
how do you think we should prioritize scientific advancement while also upholding the highest standards of animal well-being and public health?
Mhm.
Where do we strike that balance? It's something we'll all need to keep thinking about.